Good morning. This is Unit 3 presentation for our non-management group. This is Robert Michael Paisley. This is California Intercontinental University, Management 615, and Professor Charles Williams. And today is June 7th, 2019. And our presentation is over Springfield General Hospital. As we looked at our Springfield Hospital, we found that we had some incompatibilities, some problems with our system and how we handled our patients' prescriptions and or inventory that we had. And these are a list of our major findings, but they're not limited to the things that we have. To begin with, we found that we had our medication that we have here, and understanding of all the adverse effects that it can have on our patients, and the differences that if we use certain medication to others, what it would do to certain patients. So we need to find, to do something about this. Another issue that we find that is hurting our facility is knowledge of the patient's allergies. Having that information handy when we go to prescribe the medication or prescribe anything for that patient, is having that information without spending a lot of time getting it. And finally, another major issue is our doctors are handwriting their prescriptions and giving it to the nurses to order, and our errors in legible handwriting is hard for these nurses to decipher, and we're getting the wrong medication, the wrong dosage, and we need to fix this problem. And so we go over our first fix. Management implemented a new computer system called the CPOE, and in that CPOE, doctors were able to enter their orders straight into the system, kept our orders legible and easy to read for the nurses, and it tracked what we were giving the patients. Second, everyone was able to get online and see these orders as they tracked the patients, and and got to that information. The COP would cross the patient's history and look at what the doctor has given them or prescribed to them, and make sure that it did not affect that person because of any allergies or any issues that that person have. And so this would help with the errors that we have. And then it would display any complete medical history real quick. Well, not quickly, but it would have it on the screen so that that doctor could see the medical history without having to dive into a big medical folder, and this saved a lot of time. And last, we implemented training on the system, so our doctors, nurses, pharmacy, inventory, admin, billing, everybody got trained on our system, our new system that we put in, and so that everybody was up to date on what we were doing. Although we rolled out this new system, we did find some problems, and it showed us that not everything was perfect. And so now we have tried to eliminate some other issues. We found new problems with this, and these are outlined here. As you know, we have found incorrect dosing calculation. So this calculation is not looking at the inventory right and giving you an exact number that you need to order for your patient. So we need to fix this calculation based upon the inventory numbers and what we bring into the inventory base, and give you the right output so that you pick it up in inventory that you have exactly what you need. We also found some problems with the discontinued medication changes. these changes were not being forwarded to the doctors, and so when they prescribed a medication, and if it had been discontinued, that doctor was unaware, and so there was a lot of lost time trying to find a medication that we no longer have in our inventory. So we need to find a solution for this. And then, of course, the patient confusion. As everybody knows, the wording is real small, same last name, same. Bringing this up, we have started to see, patient confusion as we're having the wrong patients. We're still having some problems with having the right medication to the right patients. So, as management has talked, we're going to implement some new fixes for the system, and we're going to tell you here and teach you on these new fixes. So, first, we're going to implement some new math in the system that would look at the inventory and calculate the correct amount correctly based upon what we have in inventory, looking at the different quantities we have, the different milligrams we have, and give you those right dosages. We have added a new position, someone to come in and input and keep up with the inventory of what we have in our system and take out the discontinued medication. And then we also put in some alarming so that the doctor tries to prescribe a discontinued medication, that it will not allow them to send it on to the next person in line who needs to see that. And then if they are trying to give a medication that is discontinued, some drop-down lists to look at that medication, give them a list of similar medication that is the replacements for those. And this would help streamline their time of looking up that medication so we can get on to other patients. And finally, the confusion for the patients, we're going to implement on their wristband with barcode and put scanners at each computer station so that you would have to scan that wristband, which would then bring up the patient's history on the screen based upon that wristband's number so that you have the right information every time. And so before you can log in, do anything, you would have to scan that, and this would allow to keep our confusion in the patients. And so as we've gone over all these changes that we're going to implement, of course we're going to train and show you these changes, and then we would appreciate any questions or concerns at this time. And if there's no questions or concerns, we just want to say thank you for attending our presentation and look forward to moving on. Thank you.